Welcome back. Today we're talking about the anatomy of a dosage calc problem. Yada, 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 yada. Are you intimidated by dosage calc problems and all the words that they have? Well, let's break it down and study the anatomy of a dosage calc problem. What we need, what we don't need, and how to cut the fluff. Cut it, cut it, cut it, cut it. Yes. All right, so the first part, the patient's information. It'll say they're a male, female. Sometimes they'll have the height. Most importantly, they'll have the weight. And sometimes they'll include the diagnoses. This is all about the patient. The only thing that you're really going to need to solve these type of problems, just to figure out how to get a dosage of medications, is the weight, especially for heparin and pediatric problems and other weight-based medication. So the second part of the problem is going to be the doctor's order. We as nurses can't do anything without the doctor's order. So we're going to look at the drug, and it will be listed as the brand or the generic name, the strength of it, how much is in the concentration. And it could be in milligrams, it could be in grams, it can be in units, whatever. You're just going to see how strong it is. Then the route, is it going to be PO, IV, IM, PR? Okay. I haven't regained my composure. Intradermal, intrathecal, transdermal, sub-Q, especially if it's heparin. Then you'll have the frequency. How many times do you give this drug? Twice a day, which is BID. 3 times a day, which is TID. 4 times a day, QID, Q2, Q3, Q4, Q6. However many times. Now this is important to know your abbreviations, the QD, BID, TID, QID, because that tells you how many hours apart in a 24-hour period that you're going to give the medicine. Some questions ask for how many divided doses you should administer. So that is the part that you need to know. You got to pay attention to what it is asking you. Another part of the question would be the drug. Usually they give the brand name and they'll have the generic name in parentheses, or vice versa. And they'll tell you sometimes what they're giving it for. Usually it's an antibiotic, and they'll say what kind of infection that they have, or heparin if they have like a blood clot, or some other process that requires anticoagulation. And then it'll tell you the strength. You always got to have the name, the strength, how strong it is, whether it's in like the base unit, which is grams or milligrams, micrograms. You'll hardly ever see drugs in kilograms. That's a bit much. They usually start at grams and they go like smaller and smaller, and or units. And then the volume. So when these drugs come packaged from the manufacturer, you have a bottle, a vial, an IV bag, whatever. However it comes, it'll have the strength and how much liquid that the bag or bottle or vial contains. The last part of the problem, and this is not all problems, this is just IV problems, is the rate. So it'll tell you how many milliliters per hour or drops per minute that the prescription or the drug should be infused in, and then if it doesn't tell you that and you have to figure it out, it must tell you the IV tubing, the set, if it's going by gravity, the drip factor. That's what I was trying to say. Drip factor, drop factor, drip factor, drip, drop, drip, drip, drop, drip to drip to drip, drop. She always taking my shine. Those are all the parts that you need to know. The rest of it is fluff. Fluff. Okay, so remember that we need to figure it out what exactly we need to find. So we know that the drug comes in either an IV bag like this or in a bottle like this. Either way, you have the little particles that are floating around. It's the actual drugs. And so it's like the grams, the units, the micrograms, the milligrams, whatever it is supplied in. And then you have the suspension liquid that it's in. The diluent could be normal saline, half normal saline, D5W, whatever that the manufacturer places it in. How many particles are in, the bottle? That's what you're looking for. That's what you're trying to figure out. How many to give the patient. So when you know exactly like what it is that you're asking for, it's not like you're solving an actual math problem. You're trying to figure out how many of these little doodad dots come in a liquid form that you need to give to the patient in IV, orally, subdermal, intrathecal, subcutaneous, however. Right, so let's do a problem. It says a patient who is to undergo open heart surgery is to receive a continuous infusion of heparin during the procedure. The order is for 35 units of heparin per kilogram an hour. The patient weighs 172 pounds. The heparin solution available is 20,000 units and 500 milliliters of normal saline. What is the flow rate for the ordered heparin solution? All right, so we got to find the background information, which is the patient. And we see where it says the patient. So find where it says the patient. So a patient, okay, going to heart surgery. Nice to know. All right, they're going to get heparin. All right, that's not about the patient. That's the order. And then we go down to it says the patient weighs. So that's something that you need to know. All right, do you see anything else about a patient? No, you have the order. Go to what it says for the order is that. So you got the drug, how many kilograms per hour, how many units, and that's what the doctor has ordered. All right. So then we need to know what is the drug, the heparin. How does it come? All right. So the heparin, boom, is available in this many units and this many milliliters. So now we need to know what is the flow rate. That's what it's asking. Okay, so this is flush. This is telling you that it's going to be a continuous infusion. So that means that it's just going to keep going. It's going to be an IV. All right, so let's solve this problem. So we know that the order is for 35 units of heparin per kilogram per hour. The weight of the patient has been given to us in pounds. The first step is going to be to convert the pounds to kilograms. And we'll do that by taking 172 pounds, dividing it by 2.2 kilograms. And I always like to label. I think it's going to be 78.18. And I always just like to keep my values like in the calculator. The less steps you take, the less mistakes you make. So if you don't clear it out and you just keep it there, then you won't put in the wrong numbers. You're like, oh, I thought I had the right values, and then when you look at it, it's like, oh, I pressed a 2 instead of a 1, and that can throw your whole rate off. So we have our kilograms, And then we need to know how many kilograms an hour and how many units. So the order tells us that we need 35 units per kilogram per hour. So we're going to take this number right here and we're going to times it by the 35 units that the order calls it for. And that's what you get. So we have how many units per hour that we need, and we need to look at the heparin that is supplied. And it says that it's available in 20,000 units in 500 milliliter normal saline. So in a whole 500 milliliter bag, we have 20,000 units. We need to give our patient this much. So we need to figure out how much of the liquid needs to be infusing in the IV in 1 hour so we can put it into the pump. So let's set it up as a ratio and proportion. Now, I am a ratio proportion advocate. I don't like dimensional analysis because I feel like it's too many different parts. Now, the less steps that you take, the less mistakes that you make. If that's your jam, then rock out. But baby, we're going to ratio and proportion it today. We're going to ratio and proportion it today. 20,000 units over 500 milliliters. And you always want to label what you're writing out so you know what it is that you're trying to find. So we're trying to find X because we don't know how many milliliters that we need for this amount of units to be. So we're going to cross multiply and solve it as a simple math problem. So you'll get 20,000 X equals that number times 500. And it's going to be a long number. And I'll write it out on the screen just so you can follow along with it. And then we know that what you do to one side, you've got to do to both sides. You got to be fair, y'all. Got to be fair. So that's going to cross out. And I'm going to put it in my handy dandy calculator. And it's going to equal 68.4. And we know that you can't give a 0.4 milliliter in a pump. So what you're going to do is round. Or if the exam tells you to round to the 10th or round to the whole number, whatever it says, do. But in real life, what we would put this pump on is going to be 68. And that is how you do that one. Let's go to another one. The doctor ordered phenobarbital sodium, luminol sodium, 60 milligrams PO in divided doses TID. The available dosage forms are 30 milligrams per milliliter injection vials, 16 milligram capsules, 20 milligram per 5 milliliter elixir, and 15 milligram tablets. The therapeutic level is 15 to 40 micrograms per milliliter. The patient's phenobarbital level is 0.035 milligrams per milliliter. What should the nurse do? We're going to figure it out. That's what the nurse gonna do. Okay, so let's look at our problem. The background information. We don't have anything about the patient except for that his phenobarbital level is this. And we know that the doctor is ordering this. And so it's going to be by mouth because that's what PO stands for. And it's going to be in divided doses. TID. TID means 3 times a day. So divided doses over 3 times a day. So that's going to be 60 milligrams over the whole day, 3 times. So 60 divided by 3 is going to be 20 milligrams a dose. Alrighty. The available forms of the drug are an injection, some capsules, elixirs, it's got alcohol. All right, 15 milligram tablets. And then it's telling us that the therapeutic level of this drug is this. And then what should the nurse do? All right, so the first thing that we're going to do is look at the patient's information. The only thing that this is telling us is not telling us a weight, it's not telling us a diagnosis, it's not telling us what kind of procedure that the patient is going to have. It's just telling us that their phenobarbital level is this. So we look for in our problem for another hint. It says the therapeutic level is this. So let's see, we got this level and we see this level. So let's compare this level to that level. But this level is in milligrams per milliliters, and the that was a little sloppy, y'all. Boom. So that level is in micrograms per milliliter. That means we have to convert. So let's convert. So we have 0.035 milligrams. So we need to go from milligrams to micrograms. So when we go from mite to slight, because a milligram is way bigger than a microgram, you go mite to slight to the right. So we're going to move the decimal place 3 spaces to the right. 1, 2, 3. So that's going to be 35 micrograms. And if we look back here, it tells us that the therapeutic level, so that's the level in the blood that the drug is working, that is not toxic, that is not subtherapeutic, which means that it wouldn't be working. It's cool. It's doing what it needs to do. Is 15 to 40. Okay, so we got 35. So he's therapeutic and we need to keep him therapeutic. So what else we need to do? Because I mean, it just said, what should the nurse do? Well, the doctor told you that he wanted 60 milligrams in divided doses over the day. So what we're going to do is give the medicine, because he's therapeutic, he's not toxic, and he's not subtherapeutic, and we want to keep him where he's at. So let us look at the order. We have the phenobarbital, and we need 1 dose of it. So that would be 60 milligrams divided by 30, which would be 20 milligrams. Do we see any preparation that is how many milligrams that we need? It's right here. So that's how much we're going to give them, 20 milligrams. So let's figure out how much elixir to fix up for our patient. So we have I use desired over half in this case. I don't like dimensional analysis. 20 milligrams is what we need. 20 milligrams is how much is in 5 milliliters. These cancel out, so it'll be 1. So 1 times 5 is going to equal 5. So that's how much we're going to give. Let's do another one. The order was for benzyl penicillin procaine, Vicillin, 4,800,000 units. IM as a single dose to treat uncomplicated gonorrhea. The available stock was 2.4 million units per milliliters. The nurse will give. Gotta figure it out, don't we? So in this case, all right, the background information. We know that this patient has uncomplicated gonorrhea, and that's it. That's all we need to know about the patient. And then the order is for, see, it says the order is for this drug, this many units, and this route as a single dose. So we just need one time dosage. All right, so let's look at the dose of the drug. Well, not the dose of the drug. Let's look at the drug and how it comes prepared. The available stock was this many per this many. So 2.4 million units per milliliters. So we need to figure out our dosage. All right, so let's see. We do half, desired over half model. We'll do the desired over half model again here. I think that's most appropriate. Don't give me no dimensional analysis. No dimensional analysis. So for the, well, not 4 million. Ooh. Write out all your zeros. Units over 2.4 million units, and it comes in a milliliter. 1. So gonna put this in our handy dandy calculator, or since it's 4.8 and 2.4, you can write it out like this. And what is that going to equal to? So 2 times 1 will equal 2 milliliters. So that's how much this patient is going to get. Are you getting better at it? I feel like I'm asking questions to an audience like Dora the Explorer. Like, do you see this? Do you see that? Let's do another one. A patient weighing 88 pounds must be given cefotaxime sodium chlorpherin 180 milligrams per kilograms IM. The drug stock is 500 milligrams per milliliter vial. The nurse will give. Let's figure out what the nurse is going to give. All right, background information. The patient weighs this much. Boom. And they will be receiving this drug. And the order is going to be for this much. And the drug stock, so stock is this much. So let's figure out how much to give. So first we know that it's milligrams per kilogram, and it's going to be IM. So they're going to give it in a muscle, intramuscular. So we're going to convert our pounds to kilograms. And we know that's going to be 88 divided by 2.2. And it's going to equal 40 kgs. And then we're going to see that it's 100 milligrams per kilogram. So we're going to times this 40 by 180. And we're going to get this many. And so now the drug is stocked as such. So we should do our desired over half model formula. I guess it would be appropriate to call it a formula because it is a formula. So we're going to call it a formula. We're going to do our desired over half formula. This is how much we are desiring. We have this many in a 1 milliliter vial. So let us put it in our handy dandy calculator, and you're going to get 14.4 milliliters. Now that's I guess they're going to have to give that in a big old muscle. All right, let's do one more. Ooh. This one's a humdinger. It says A 46-year-old client who is alert and oriented has been receiving hemodialysis 3 times a week during the last 4 years. Upon follow-up checkup, the client complains of difficulty of breathing and chest pain and was later on diagnosed with pneumonia. Assessment reveals a temperature of 39.0 degrees Celsius, heart rate of 98 breaths per minute, respiratory rate of 38 breaths per minute, and a blood pressure of 110/80 grams. Blood pressure of 110 milligrams per mercury. The physician prescribes Rocephin, which is ceftriaxone, 0.5 grams and 250 milliliters of D5W to infuse via IV piggyback within 45 minutes. The drop factor is set at 12 drops per minute. How many drops per minute will you regulate the IVPB to suffice this order? That's a lot of information, but you know what it has? Fluff. Cut the fluff. Cut the fluff. All right, so let's attack this problem. Alrighty. So let's look for the patient information. We got a lot of it, but what do we need to figure out this problem? We need our formula. So what is that going to be? Your volume over your time times your drops per milliliter. So all this stuff right here. Fluff. Don't even look at it. It's fluff, fluff, fluff. Don't get thrown off by that. So the order is for this drug, and it comes as 0.5 grams and 250 milliliters of D5W, which is dextrose 5 in water. 5% in water, and it's going to infuse via piggyback. Piggyback, don't let that scare you either. Piggyback just means that it's going to be hung. It's going to be hung higher than your primary bag. So let's say you have like a D5W going already. This bag is going to be hung higher than your primary line, and it's going to infuse down and share the same line. And once this gets done infusing, this is going to pick back up. So that's all that means. It's a piggyback. Don't be scared of IVs and IV pumps. I promise you, you're going to get it. All right. So 45 minutes. Boom, we need that. Then what else do we need? We need what the package tells us, how many drops per milliliter. So that's your drop factor. You got that bad boy too. So now all we have to do is plug in our formula values. So we will have 250 milliliters over 45 minutes times 12 drops per milliliter. Your milliliters cross out. Oh, I forgot to put my minutes, y'all. Alrighty, so when you do these type of calculations and you have like to multiply multiple values across the top, then divide by multiple values at multiple values across the bottom. When I put it into my calculator, I just do all your values across the top multiply. So 250 times 12, and that's it. All right, so then now you go to the bottom, so you hit that divide. So that's 45, and if you had like one more value, you would hit divide again, but this is it. So less steps, less mistakes. And what we get? 66.67. Jesus, Jesus, Jesus. Okay, we're gonna round it to boom. Yay! So that's how many they'll get, okay? The more that you practice identifying these parts of the dosage calc problems, the better you'll become at knowing what it is that you're looking for and why you're looking for it and what it is that you need to answer. Always go to the end of the question and see what exactly is it asking for. Label your units. Make sure you don't have any trailing zeros, and you must include a leading zero. And just make sure that it is for 1 dose if it's asking for 1 dose, because some of the times you can just be required to calculate all of the dosage, but then it's like, if it's every 8 hours and they receive this many, how many is it for 1 dose? You have to pay attention to the wording because they'll try to trick you. They just sneaky. If this did help you, be sure to like and subscribe and share with other nursing students or health professional students who have been bogged down by dosage calc, but we will not be bound. We will graduate and we will be successful. So you get coffee, baby.